So if you have deflated breasts that when you tuck them into your best bra, you have plenty of volume, not the padded one, but the bra that you like, tucks all in and you actually feel good about the breast volume and shape, then a breast lift without an implant might be a good option for you. When I do breast lifts without an implant, we bring all the living tissue into the breast. The nipple is not separated, but it tucks in, a little bit like breast origami. The whole center of the breast slides and tucks. I rinse it with a sterilizing fluid, and then I'll put in an internal support bra made out of a little demi-cup bra of absorbable mesh. That bra will dissolve between 12 and 18 months, but it induces a layer of collagen that creates an internal bra of your own scar tissue that helps keep it perky over time. By using a lift technique, which we support the weight of the gland with the support mesh, we will get a nice round perky breast that looks like an implant without an implant that looks awesome. Okay, but what if when you put on a bra, you don't have enough volume, especially at the top? All right, in that situation, we'd like to use an implant, but maybe the patient doesn't want a breast implant, or maybe they don't want a future surgery to remove or replace the implant. They're a once and done. You get me one time, make it look better, I'm never coming back. I get it. In that case, we might consider fat grafting. Fat grafting is the harvest of fat using liposuction, classically a little inner thigh, maybe the flank, an area where you have extra fat, perhaps around the belly button. We can take a little bit of fat, harvest it into a filter, using antibiotic irrigation, rinse away broken cells, blood cells, oil droplets, so we only keep the viable parcels of fat. I did a research fellowship with the Department of Defense in 2009, 2010, presented at the national meeting the results of my studies in which we optimized the harvest and transfer of fat and looked at every element of that fat processing. How do we keep the fat alive? Because, you know, some surgeons, 30%, 50% of the fat survives. In my hands, we studied it, 78 to 83% of the fat survives. How? Low pressure harvest, gentle cannula, the correct tubing so we don't damage those fragile cells, rinse with warm lactated ringers with clindamycin, then rinse it with a filter, take away the broken cells, take that filtered fat and inject multiple stripes, multiple directions, and not overgraft. If you overgraft, put way too much in, how can it get blood flow? It can't. That's just trash. Dead tissue is not okay. We want only living fat, right? There's no point if it's not alive. So we graft only the right amount to get the volume we need. I don't like to graft more than about a cup size, so if you're wanting 3 cups, it's not possible safely. It's not going to work. But in my hands, we can get about a half cup to a cup size of fat, typically in the upper areas where I use it to get that finesse. If the patient's got a lot of appearance of ribs in the sternum, or if they have a sternal dip or a sternal deficit, I can smooth that like living spackle and get a nice softening result along the cleavage. Fat is nice for finesse, but kind of like construction projects, you use fat like spackle. You can't build an entire building or house out of spackle, but it's an important element to getting a beautiful result. Fat graft can help, but it can't replace an implant.